Hello, everyone. My name is Mark Hagiyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient slash survivor. Been dealing with cancer since 2021, and I'm doing very, very well. We're very, very happy here in our new home in Texas, and just so excited for our guest today. And she's got an unbelievable story. And so what I'd like to do at this time is I'd like to bring on Rochelle Prosser. Rochelle, please introduce yourself and tell us your background because that's important here as well.
Awesome. Thank you for that warm introduction, Mark. It's so exciting to be here with you with a cancer survivor, and your story is just astounding. And having this opportunity to share the space. So I'm Rochelle Prosser. I'm the mom of two, and I'm the mother and wife of two cancer survivors. Um, I am a neurotrauma ICU nurse first, and being a healthcare provider and now being a caregiver was something I had never anticipated, looked for, or even imagined. And so this is where I am right now with having two cancer survivors, and it took 15 years of cancer to get through it all.
So you have a very unique perspective of both sides. And so let's get into how your cancer journey started with your daughter.
With my daughter, okay.
Yeah.
So my husband was diagnosed with cancer first.
Oh, she
He
was. Oh,
survived.
okay. Let's go.
Yes,
Let's talk about that first and then go
yeah,
into your daughter then.
yes. So he was diagnosed with lung cancer, and at the time they were using anthracycline and tamoxifen to help with his type of cancer. But I was working at a hospital, and I was in one of their conferences, and they were talking about this new drug, cisplantin and vincristine, and how it was saving the lung cancer patients back in 2007 and 2008. And so, of course, I ran home to tell his doctors they've got to change the chemo because what they were proposing wasn't going to work. And having to navigate with him with lung cancer. All he wanted to do was cut it out and keep going. And I knew that there was a better way. So navigating that from a spouse perspective and giving the education that he needed to really save his life, understanding that there's more nuance in just you've got cancer, cut it out. That was a journey. But then his cancer came back a few years later in 2014. And just the month before his cancer came back, our 4-year-old daughter was diagnosed with this really obscure, common, but her cancer was really aggressive astrocytoma, pylomyxoid astrocytoma. And she was 4 at the time. And a month later, my husband's cancer came back.
Can you
And so
explain what your daughter's cancer is? I've never heard that.
So astrocytoma is very common in children. It's one of the most common brain cancers. But unfortunately, with my daughter's cancer, her cancer was considered a mosaic. So it was more of just an astrocytoma. It involved other components of the brain, as well. It also involved the vascular system, where the blood flow works and flows. So it was really more aggressive. It ended up being part of her optic nerves, the nerves that you use to see. It was part of her brain stem, part of the pons. It was part of the brain that cleans any debris out, which is the astrocytomas. And then it was part of the cardiovascular system for the blood vessels. So all of that together and add it to the processing centers of the brain, it was really an inoperable tumor that you could take out. And there was no treatment at the time that was going to take it all the way down.
Wow.
Mhm.
So at this point, what's going through your mind? You know, being in the medical profession and having this happen to your family. That's wild.
My, My husband was hospital averse. If he only knew that you went into a hospital to die. So having to now navigate that, he needed somebody to sit and walk through this journey with him, as well as you have someone who truly is innocent and doesn't even know the first of what cancer is or what normal is and can take care of themselves. It was really difficult because I had to make a choice. I had to make a choice who I was going to help. So I piled the other older two children in the car with my youngest and off to St. Jude we went. I had to leave instructions for him and his family. And through that separation, he didn't take care of himself. He waited until I came back with my daughter before he did what he needed to do. And his tumor was extremely aggressive. So from fear, people put themselves in situations that prevent them from moving forward to early intervention. And so we had to deal with that as a caregiver, as a healthcare provider, but also as a caregiver and a spouse. So that was really a hard road to navigate.
I, oh my goodness, it's hard for me to hear that.
Mhm. Yeah.
Wow. And so you went to California then?
No, I went to Tennessee. We went
Oh,
to Memphis,
Tennessee.
Tennessee.
Okay.
Memphis,
Uh,
Tennessee. Was it not? Yeah, Memphis, Tennessee. And we stayed there for a few months. We stayed there for a while and then came home to finish up the treatment. And my daughter was in remission for about, I would say about 2 years, 8 months, 2 years, 6 months, and then I could slowly see it coming back. And so we did her make a wish and they put her.
what did you see?
She went through 9 pairs of glasses in less than a year.
Oh,
And so I knew that her vision was getting worse and worse, but um, because of the confines of the clinical trial or the the conventional treatment that we were on, the tumor had to come back to its original size and then grow out of that. And for her, she had it all over her body. And so where we could take it out, we did, but in her brain, we could not. So what was left was what was in her brain. And so that has to now go to the size, adding up for all of the different tumors in her body before something will be done. And these are some of the things that people don't understand that become extreme barriers in finding early intervention when you, as that healthcare provider, or you as that caregiver are saying, something's not right with Mary today. Like, we really need to intervene. My daughter's name is not Mary, but I'm just using that as an example where you can see it as that caregiver that something just isn't right. And it's getting them to move faster or intervene sooner so that it doesn't go back to where we were, where we started. And a lot of the clinical trials or conventional treatment, they have parameters that it has to do that before they intervene because the treatment is so hard on the body.
so
But in her,
how did you
Mhm.
navigate the situation with you as a medical professional and a mom in this situation? I mean, how?
Oh God. Honestly, I thought God was laughing at me because my daughter has brain cancer and I do neurotrauma ICU, which is I work on the brain. You've hurt yourself and you also managed to give yourself a brain injury. And so here it is. Cancer is one of the worst brain injuries known to man, other than having a stroke or having a hematoma, which is where you have bleeding in the brain. But all of these things can happen and stem from a brain tumor. So I knew way too much, way more than any person should know, way more than I would ever put upon a person. And so I had to learn that my mental health was very important. I learned not to answer the phone. I learned how to say when I needed to sleep, which wasn't much, because I didn't want to miss a moment with her, because if anything happened, everyone's going to be looking at me. So as a healthcare professional, we often tend to say we're the go-to person in the family to find answers. And then when there just isn't one and we don't know what that answer is, everyone's looking at us to say, try this, try that, rub this, eat that. And sometimes it can be helpful, and a lot of times it's not. And so for me, how I navigated it, and the most important thing for me was making sure that the healthcare provider that was directly responsible for my child and for my husband understood that I needed to be a spouse and a mom and not their colleague. And sometimes in some spaces, I had to be that colleague because there just wasn't an answer to move forward. And so they're looking to me based on the years of experience that I've had dealing with other people with brain cancer or other people with cancer. And so I became very quick that resource in a way that I just didn't want to be. I just wanted to be a mom. I just
Wow.
wanted to be a wife.
Wow.
Yeah.
So how did your daughter react to all of this? I mean, was she scared? Was she, uh, you know, I mean,
So when she was 4, yeah, when she was 4, she didn't know what being a normal kid was. That concept, hey, okay, I don't feel well, I'll stop moving, and then eventually I'll feel better. So you get up and go. When she relapsed at 8, and as we were trying to find her alternative care, up until she was the age of 10, when she got her first dose we did a targeted DNA at that point because the medical technology had caught up to her. And when she took that pill, she said, oh, if I knew that this is what it's going to be, I remember this. If I knew that, I would have never done it. And so she systematically told everybody that she could find, and anyone who would listen to her, make my mom stop. Please make it stop. I don't want to do this. And I wasn't ready to stop because I know the child that I had. She was saying this from a situation because it was really uncomfortable. And so when things got too hard for her, then I would go back to her providers and finding that ally in the office to say, this is too much. This is bigger than my toolbox. I can do all of these things, but I can't take away X, Y, and Z. So if you can handle that, then I can deal with this side. And so it was very important to have that communication to say, we're one in this race, but if the cure is worse than the disease, then we're doing something wrong. So let's reevaluate and make sure that my daughter had a voice. But oh, she was terrible. She was terrible. She tried to beat up everybody that she could find. So, I mean, you're dealing with a child that doesn't want to be touched in a certain way, doesn't want to interact with the healthcare system in a certain way, but she has to in order to survive. And understanding that they don't have an understanding. I think it brought it home to me was when the doctor was telling her what DNA was and why they had to look at DNA. And she turned to me and says, Mom, what is Dana? What is Dana? What is this DNA Dana stuff? And I said, well, you have to ask the doctor. And he gave some obtuse answer. And I'm like, I think you just need to look at it as Lego. And you have the white block that goes with the yellow block and the red block that goes with the blue block. But sometimes the red block and the blue block can be switched out with the green block. And sometimes the white block and the yellow block can be switched out with the black block. And if that happens, then you have cancer. And she's like, oh, okay, I understand. Where do I sign? And so I realized that most people don't know what questions to ask. And even looking at it from a kid's perspective, the more she understood was the more she felt in control and the more she was willing to participate. It was when she wasn't invited into the decision room in a way that she could understand and relate to, that's when problems occurred. So I try to really focus on the situation and make sure that there's clarity and truth and not sugarcoat it. Because if it's going to hurt, tell them it's going to hurt, but it's only for now, and they'll give you something for pain, and it's going to take that pain away. And then make sure we do that, live up to what we say.
So how is she doing now?
So we just went to visit her radiation oncologist on Wednesday last week. And that would be 3 years and 3 days after we stopped radiation treatment. And the cancer is gone. It's
Oh,
this
that is
little faint
fantastic.
shadow. It doesn't even take up the dye. He said he put her into cancer survivorship. And so our journey with active cancer is over. And now we are moving into a recovery phase and learning all the things that we didn't do while we were in active cancer and just learning this new normal of survivorship.
Wow. Wow. I can't even imagine. Uh,
Yes, so it was 10 years to the day, 10 years to
uh,
the day. She's 14 now.
oh, that's great. That is really great. And is she happy with
Oh yeah, she's telling everybody that she's a cancer survivor and she's no longer a warrior. She is over the moon and overjoyed. I think as you as children transition from being in that pediatric space and into um, adolescents and young adults, they really do understand the importance of having good health and why they don't want to stand out and be different. And so being able to say, I did something great and now I'm just like everybody else is freeing. It's freeing. And a great relief because she always worries, am I going to have to go through this again? I don't want to go through this again. So knowing that she doesn't
I
have
don't
to.
blame her. I don't blame.
I don't blame her. And it would be her decision at that point because going through it twice with her and twice with my husband, I think that's one mantle and gauntlet I need to put down.
Wow. Wow. So I'm so happy that she's, you know, in in the condition that she is now, which is really phenomenal. So and my hat's off to you for just being, a mom first and a medical practitioner second, because that's the most important thing is, your family and your loved ones need to know that, you know, you're the mom and you always be the
Mhm.
mom first. So
Yeah.
that's beautiful. Absolutely beautiful.
Oh, yeah.
So let's talk about your husband.
Oh, so my husband, um, he's doing great. He's doing great. He's getting ready to retire, and it's been 25 years that we've been together, 15 of it being in cancer in some semblance with him and with my daughter. And it's really nice to move into this phase of he's getting ready to retire. He worked all the way through to my chagrin. I thought I was going to lose a gasket with him, you know. Because at some point you need to rest and let your body heal. And
Yes.
him being a man and going through that, understanding that everything is dependent upon him, as well as he has another child going through it just like him. There's a lot on his shoulders that he takes on. And I can't speak for him. I can just be that wife to say this is what you need to know. But I think what he taught me something that was really profound in that he didn't even know what questions to ask. And even when I explained it to him, it wasn't in a way that he could even take in. You just sometimes there are just folks that are like that, that no matter how low or how high or how softly you give that news, it's not going in because they can't even fathom themselves as being ill. And so you go to what you know, which might be the Bible or your spiritual being or whoever that being or object is that you fully believe in to help you through this. So he'll say to me, I didn't even see as myself as having cancer because that was a non-starter. It's just because it's negotiable. That's why I have my wife. That's why I have you. So I'm not even going to deal that or breathe it in. It's not, it's a blip on the map. I don't even acknowledge it.
Wow.
And yeah, that's a whole different perspective, right? So when we talk about
Yeah.
who's the one that's going to have the mental health issue on it, you would think that it would be the patient. In that case, it was not. It was the wife. It's like, what do you mean you don't see yourself that way? And it's taken a long time for me to understand his perspective, and his perspective is just that I don't have time to take it on and agree with that. If I agree with that, then that means that it's real.
Mhm.
And if I believe spiritually and I believe in the God that I serve, then he can move mountains and make this go away. And I never have to deal with this because this is not my journey. This is not my message. This is not my thing. And truly, uh, except for maybe 1 or 2 days right at the onset of receiving his chemo, it didn't bother him. He did everything that he needed to do, which was shocking. It didn't stop him. He didn't skip a beat. Um, so for him, he's good. And so I take that and say, there's a situation. Oncology and cancer is a situation. How you deal with it and how you view it will be how you find hope and how you find happiness and how you find joy. Because to be honest, I still don't know how we're married 25 years, but we are. And I'm not going anywhere, neither is he. But we've been through a lot, and with that comes great wisdom and appreciation and understanding and tolerance and just love. That's it. Just love.
So how did your husband relate to your daughter as far as being cancer patients?
I think he related better than I did because he walked the walk.
Mhm.
He took the IV chemotherapy. Actually, one of them they shared together, the vincristine. And so he understood what it felt to have the fingers tingling, your toes tingling. He understood and understanding that when sometimes you take these nausea medications and you'd rather just not do it and toss your cookies and feel better than to take something that makes it feel like you have rocks in your belly and you still throw up anyway. So there was a level of understanding and connection that the two of them had that I could never understand because I hadn't been there. But on the other side, being so close, you compare yourself to the other, and that might not be the best thing to do because everyone walks their journey in cancer differently. There's a lot of things that are similar, but there's an even greater amount that are different. And so, I think my family was just fortunate having me there to be able to ask the right questions and make sure that they got the care that they deserved and needed even when there wasn't any.
Boy, I, you have been on a journey. That is for sure. And I so admire, the way you were able to navigate it because and for the length of time as well. That is a long time to deal with it. And so my hat's off to you, and I really commend you in all that you did in this situation, and all that you continue to do. That's really fantastic. So why don't you talk briefly about what you're doing now as a result of all of this?
And I kind of touched on how to deal with the emotions and how to deal with in a beneficial way what you've gone through because it's a lot, it's a journey, and it's heavy. And for me, I could not take what I learned and not do anything with just say, okay, my people are good, peace out. All right, I'm good. I'm going to be Nixon and out I go. That didn't sit well with me. And I had to figure out for me to make it make sense. Because why two people in my family, immediate family? Why my child at the same time? Like you wouldn't wish that on your worst enemy. So the only thing that I could see that was the difference was what I knew, what I learned, and how I learned to communicate and ensure that we made sure that there was evidence-based and medical science when it needed. You know, we have that holistic approach, but when you actually have the cancer, you need to turn to what is out there for those medical professionals because they are the ones that can help you. At least it was that way with my case, and it's not every way for everyone, but in my case, we really needed that next technological advancement because there was just nothing out there for us. And so I had to make it make sense, and I could not replicate myself. And the only way that I could do is to focus on what I knew. So I built a cancer treatment library that houses all cancer therapeutics in one place. So you can go there for answers when you've exhausted everything out there, that you don't know where to go. It was something that I truly needed and wished I had going through that journey with my family. And so that takes a lot of stress out. I'm not going to say that it's going to cure everybody. I don't make that, but it gives you another something else to talk about, something else to think about that just might work, but at least you can have that conversation with your healthcare provider instead of saying it's time for hospice. Because sometimes people go to hospice because they don't know that there's options out there where it's a zip code thing. Because of your zip code, you don't get access to these drugs and therapeutics. Um, my cancer treatment library takes those barriers out the way.
So what is it called?
It's called the Prosser Cancer Treatment Library. That's it.
Okay.
And my company is called Orchid Healthcare Solutions. I'm a nurse, and it's a nurse-led tech company that deals with oncology, oncology care navigation, and part of that offering is the Prosser Cancer Treatment Library, and then resources to help stem the tide to ensure you're not getting seven-figure medical bills like I did and help you find ways to stay on treatment longer because you don't have that financial commitment to worry about, as well as to ensure that you have a home to come back to when you're done.
Beautiful, beautiful. What we'll do is we'll put all of this in the video description so that, and if you want to get in touch with Rochelle, you could do so through her links that she will be providing. So I mean that is absolutely beautiful, and I commend you for giving back to this incredible uh, group of people that are going through cancer. So for that, I thank you.
Thank you so much. I appreciate this platform. Someone once called me recently the contact you need for a rainy day. And I thought that was so prophetic because I wished I had that individual going through this. And maybe it would have made it a little bit easier for me. But at the end of the day, we're here and I can give back and help just that one person not go through what I went through. I've done my job.
That's so fantastic. I just commend you. I've got one last question for you,
Sure.
and it's unrelated to everything we've talked about. You know, we live in a world that's very divisive and very negative and cancel culture and all this kind of crazy stuff. How would you, Rochelle, make this world a better place for all of us?
Oh my goodness. I have, and so it's a phrase. Cancer doesn't care who you are, who you love, what your political party is, who you sleep with. It's an equal opportunity offender. It truly is an inclusive disease. And when you realize that you are out of many come one, and understand that it's a community and village, and when you get there, it doesn't matter. It just doesn't matter. There's so many things that are there to divide us. And unfortunately, in oncology, they tie all of that together with a bow and say, deal with it. And so, if you're lucky enough to find a community that will accept you unconditionally and move forward to just find happiness and know that the situation for today is just for today, and how you handle it will mean whether you find joy tomorrow or not. Because trust and believe, the sun will rise tomorrow, and that situation that you didn't handle properly the day before will still be there. So you may as well do the right thing, handle it properly, and know that this too shall pass. It'll pass.
Wow, that is fantastic. What a fantastic answer. I love it. Rochelle, thank you so much for sharing your story and your family story and your knowledge with all of us.
Thank you.
We need more people like you on this planet. And, I love what you're doing. Absolutely love it. So thank you so much for joining us here at To Be Your Own Hero. We really appreciate it.
No, I'm not a hero. I'm not a hero. There was a lot of people behind me pushing me forward and praying for me. So I can't take that on. I just love. That's it. That's it.
That's fantastic. Thank you once again. And thanks to all of you out there for joining us here at To Be Your Own Hero. Please like the video, make a comment if you'd like, and subscribe to the channel. And once again, have a fantastic week, and we will see you next week on To Be Your Own Hero. Thank you so much.